every year. Better than last year.
When Roberto Danza walks into a room, he brings a few different worlds with him.
And I just heard this joke about, people from Argentina have some friends. So my father, he was Irish American, and my mama, Mexican Indian. And when you get Mexican Irish, you get this, you know. And when I go to the airport, I just got down. I go with my ticket, and it says Roberto, but then in my ID it says Robert, and some people are like, "What is it?" And I say both.
Growing up, Danzy managed to merge his identities as an Irish American, Mexican, Mayan, and Toltec, and became, among other things, a martial artist and a clinical psychologist. Then he found his calling, helping others bring worlds together, just as he did.
I get called to go to different colleges and different communities, not only here but around the world, because they are finding ways to incorporate the culture of the people that they are serving into their healing modalities or teaching modalities. When you're a healer, you have to look at the body and the heart, mind, and soul.
Danzy teaches people how to bring cultural diversity and wisdom into their work. There's growing demand for his services, especially among healthcare providers. That's because of an industry-wide shift toward culturally appropriate care, says Sally Reel, who leads the development and implementation of interprofessional education programs for the Arizona Health Sciences Center.
There is a growing sense that being able to change the way people communicate and how they interact with each other becomes important for improving patient care and the quality of that care. So it is a movement that we are rapidly engaging in at the Health Sciences Center.
Culturally appropriate or culturally competent care aims to bring sensitivity and respect for different cultural beliefs, languages, and practices into the relationship between healthcare providers and their patients.
All of us come from some place, whether it be our ethnicities, our racial backgrounds, our place, and we have differences. And we've known that when it comes to these differences, that not understanding them can actually lead to greater health inequity, meaning that it increases disparity because we do not have the cultural sensitivities and wisdom that we need to manage the diverse populations that we would see in any healthcare system. So it's really important for the Southwest, when you consider the sheer diversity of the populations that live in Arizona, that our students be exposed to this whole concept of cultural wisdom. We would expect our students to have the ability to acknowledge those differences, but more importantly, to learn how to interact with them appropriately to improve healthcare.
Sometimes students learn this by turning to other experts who study what happens when cultures come together. Susan Shaw is one of them.
The research that I do is based at a community health center in Western Massachusetts, and this clinic serves a really diverse patient population. So it includes African Americans, Latinos, low-income white Americans, as well as a diverse range of immigrant groups, including Vietnamese immigrants and immigrants from the former Soviet Union. I think that patients will have experienced this
Shaw
already,
has spent
so that
years
they will
studying
know
this
the
one
difference, but we can
particularly
also gain
diverse
that
clinic to learn how culturally competent care works. She says some elements of culture are easier to address than others. A clinic can establish policies that ensure patients have access to an interpreter if they need one, for example, but it's harder to bring knowledge about traditions or beliefs into a medical setting.
Okay. So it's all in really one. That makes sense. It's hard to ask a physician who is always pressed for time in settings like the clinic where my research is based, to take the time to ask those detailed kinds of questions to say, tell me how you think about your hypertension, or tell me about your diet, and, what do you normally have for breakfast, or what do you normally have for lunch? And then to work with that sort of baseline of information to tailor the patient's treatments.
Medical anthropologists, like Shaw, help bridge the gap.
The work of translation for medical anthropologists is to take our detailed, nuanced, complex, contradictory, qualitative findings and put them in terms that can be useful to physicians, because a lot of physicians that I speak with are very frustrated by the kinds of gaps in understanding that they encounter with their patients.
In the clinic Shaw studies, healthcare providers run into these gaps again and again. In one example, they had to reconcile the Western medical view of diabetes with the Vietnamese patient's beliefs about the disease.
It's kind of akin to the experience of catching a cold. So, for example, when I grew up, I was always told, like, don't go outside without a hat on because you'll catch a cold by the cold air getting into your hair or whatever. Some of the Vietnamese participants that we talked to talked about their experience of diabetes was related to this wind, which kind of blew away their sort of protective outer layer, I guess. So for a Vietnamese patient who's experiencing diabetes, it's kind of all of a piece with a broader set of ideas about the integrity of the human body and what can violate that integrity. And in some cases, a medication is seen as a similar kind of threat as opposed to a remedy.
When healthcare providers take the time to understand the world of values and beliefs their patients bring with them, Shaw says the benefits are real, even if they're not always easy to measure.
In the encounters that we heard about from patients, the providers who the patients felt happiest about receiving care from were those that did indicate that they had some understanding of people's sort of pre-existing concerns. And that kind of positive orientation on the part of a patient who feels heard and understood by their physician, I think can only lead to better health outcomes.
For Danza, the benefits of culturally competent care reach beyond the patient. He says they can heal the healer, too.
So we have a chance to heal part of our trauma by re-acknowledging proper ways of building communities with diversity. And it's better to have these multiple voices, multiple ways of being that enrich the human spirit. We know this, and diversity has proven itself over and over again, one of the greatest assets of humanity. A little something against the wind.